Hi, this is Dr. Tom Rogers, coming to you with a weekly podcast of the Common Sense MD. I'm going to talk to you today about a fascinating book I just finished. As a matter of fact, I've spent the last month kind of dissecting this book, and it's really interesting. The name of it is Brain Energy, and it's by Dr. Christopher Palmer. He's a professor of psychiatry at Harvard University, does a lot of research, well-known guy. Those folks at Harvard do a lot of research and write a lot of good books, if you can wade through them. So that's what I've done. I've waded through it, and I'm going to tell you what it means. A lot of times, these kind of people come up with some theories that I agree with that, I've kind of been practicing for a long time anyway, but it's nice to have it kind of legitimized, in other words. But and a lot of new stuff I've learned from him as well. Just interesting. A lot of the stories about patients, etc., are really interesting. So I recommend that you read this book, Brain Energy, by Dr. Palmer. As you know, in this country, we have a lot of mental health problems, and it's getting worse. I mean, we have all these medicines for mental illnesses, and none of them seem to work that great. Have you noticed that? But anyway, this guy has a really interesting story that I want to share with you today. I think it'll be kind of helpful for the direction of mental illness and how it's tied in with physical illnesses. Anyway, one thing that this Dr. Palmer, after 25 years of practicing as a psychiatrist, he kind of felt like a fraud in a way, he says. Because when people ask him what causes mental illness, he had no answer for them. When you look at the root cause of mental illness, is it a chemical imbalance? Is it genetics? No. He postulates it's the energy available for your brain. And this is a really interesting theory, and I happen to agree with it. I mean, there's a lot of really good points in it. So he really didn't have a good answer, and that's what led to his quest and him writing this book on brain energy. What really causes mental illness? Through the centuries, there's been many theories. Demonic possession. Hippocrates thought that it was an imbalance of the body's four humors, which are your four body fluids. He thought that the black bile was the one that caused depression. Freud thought that mental illness was due to an unconscious desire and conflict. Remember the id, the superego, and the ego back in school? Those are interesting theories, but maybe not so relevant nowadays. Then more recently, chemical imbalances, and this led to a creation of a lot of medicines to treat these chemical imbalances. Today, most psychiatrists and most doctors really go by this thing called the biopsychosocial model, which does seem reasonable. There's biologic reasons, there's psychology to it, there's social reasons for mental illness. Certainly, if you're abused as a kid, had a very traumatic childhood, you're more likely to get mentally ill. But this is not the whole story, because some people don't. So, and it's interesting how Dr. Palmer changed his whole viewpoint of this. It really changed when he started helping a patient lose weight. This patient of his had been what's called, he had schizoaffective disorder, which is really kind of a blend between schizophrenia and bipolar illness. And he had hallucinations, paranoia. He had been on 17 different medications. Nothing worked. And as a side effect from a lot of those medications, he gained over 100 pounds. As you know, that's a common side effect of psych meds, was weight gain. So when Dr. Palmer asked him to lose weight, he said, "How do I lose weight?" And Dr. Palmer had no idea. The guy would not go to another doctor that specialized in this, or a dietitian or anything. The only person he would come out of the house for was Dr. Palmer. So he took it upon himself to start doing some research on the way to help this guy lose weight. Ends up, he ended up putting him on a ketogenic diet, something I talk about a lot. But because he knew it worked for epilepsy, and when he did a deep dive on it, he knew it worked for some other mental things as well. And what happened? The guy lost 150 pounds, and his psychosis disappeared. This guy became functional and off all his medicines just simply by getting on a ketogenic diet. And again, this book is not about the ketogenic diet, but about all the factors that cause mental illness. He calls it brain energy, and it's really a problem of metabolism. Think about that. It's a metabolic problem. And it starts with your mitochondria. That's the key to this book, is study of mitochondria. Those little parts of each cell that produce energy in the cell. You know, it converts ATP into ADP. All your energy comes from ATP through the function of these little cells, the little parts of cells called mitochondria. And there's billions of them in there. But they do so much more than produce energy. They can act on your genome. They can change your DNA. They can switch on and off certain signaling pathways. That's called epigenetics, because it's not just the genetics you're born with, it's how it's modeled. So you can turn them on and off. And the mitochondria, you know, we study that a lot in functional medicine. Mitochondrial medicine is functional medicine, really. So, but it's a lot more than just energy. And it's a fact that what we're doing right now in mental health is not working. I think that's what frustrated him so much. The lifetime prevalence of mental illness is 50%. That's 1 out of every 2 of us. 50%. Anxiety is number 1. Depression is number 2. But depression is a leading cause of disability worldwide. We have many medicines that work by many different ways. And some work part of the time. I've seen this many times in my 36 years of practice. I've used them and I still use them sometimes. But 90% of people are not cured by these medications. And they have a lot of side effects. They usually target neurotransmitters like serotonin, dopamine, norepinephrine, and others like anxiety medicines, mood stabilizers, antipsychotics, stimulants, anti-epileptic medicines. They all work in a little different way. But in mental health, it's hard because there are just very few measuring tests, really. There's no brain scan or objective test to tell you what mental illness that you have. It's all subjective. It's all about symptoms. It's not concrete. That's one thing that makes it so hard. Now, he feels, and I agree with this because I practice functional medicine. And again, this is not new to me, as I look at this type of thing every day. But it turns out that there's a common pathway to all mental and physical illnesses. Your metabolism, the way things are broken down, starting with what you eat, of course. But it's complex. It's not simple because it involves many factors. Not only diet, sleep, epigenetics, your genetics, your DNA, hormones, inflammation, your gut microbiome. That's what he's talking about in here. You know, something we focus on and look at every day in functional medicine. So it's really not new, but this is kind of a big dog psychiatrist, and I hope he can convince a lot of other psychiatrists to start looking at this stuff. Because a lot of times when you go to a mental health expert, a psychiatrist is going to write you a pill, a psychologist is going to talk to you. And cognitive behavioral therapy does help. It's usually a mixture, but wouldn't you rather get to the root cause of the problem, like we do in functional medicine? Remember, many metabolic and neurological disorders have strong bidirectional relationships with mental illness. That by bidirectional, I mean one can cause the other. Both can cause the other. If you have heart disease, you're going to get depressed. If you have If you have, say, like schizophrenia, you're going to get fat. Most of them do. So it can cause metabolic symptoms. When we talk about obesity, diabetes, heart disease, and then we consider Alzheimer's and epilepsy, all 5 of these have common pathways and are associated with mental symptoms like depression, anxiety, insomnia, even psychosis. All of us have the potential to go psychotic. Like I said, people with mental illnesses, if you've noticed, are much more likely to be obese, way over double. Look at autism, obesity, autism. People with schizophrenia are 3 times more likely to develop diabetes. They call Alzheimer's type 3 diabetes. That's for a reason. It's a metabolic disease. It's like a brain on fire. All mental disorders have shortened lifespans by a long bit. I think men up to 10 years shorter, women 7 years shorter. Depression in early life doubles your chances of Alzheimer's. 97% of Alzheimer's patients develop psychiatric symptoms. A lot of psychosis. I've seen it many times. So how do you approach a patient with this? When patients are told to change their diet or to exercise, we often hear this: I just don't have the energy. Some doctors are skeptical of that. But really, they're right. It's not a motivational problem. It's a metabolic one that involves production of energy inside cells. Remember, mitochondria. Essentially, all the risk factors for mental and metabolic disorders are the same. They have a common pathway. A lot of different ways to get there, but a common pathway. It certainly includes biological, psychological, social factors like diet, exercise, smoking, drug use, alcohol, sleep imbalances, but also hormones, inflammation, epigenetics, that on and off switch, and your gut microbiome. With all these autoimmune diseases, I always start with the gut microbiome. So a lot of these things are really interrelated. So if we can somehow simplify it, we're going to be better at treating these things. And all the current treatments really work by affecting the metabolism. They either speed you up or slow you down. They switch on and off the energy by your mitochondria. Your mitochondria has that power. They switch on the energy, say if you are depressed, and they switch off the energy if you have mania or you're in that bipolar manic episode. Remember, the brain is just 2% of your body's total mass, but it takes 20% of your resting energy. That's pretty incredible. Think about diabetics and insulin. From 1927 up until the mid-1960s, insulin coma therapy was the most used treatment for psychosis and severe depression. They'd give you so much insulin, they'd put you into hypoglycemic coma. And it did work. And then all these medicines came out for it, and it kind of got displaced. So that ought to give you a clue that glucose metabolism is involved in mental illnesses. Think about estrogen. Think about hormones. Women are twice as likely to suffer depression as men and 4 times more likely to get dementia because of low estrogen. Hypothyroidism, more common in women. It's linked to bipolar, schizophrenia, and dementia. It's one of the first things we check when we check somebody that's demented is we check their thyroid. And the thyroid can affect your metabolism with your cholesterol, of course. Inflammation plays a huge role in autoimmune diseases because it causes mitochondrial dysfunction. Sleep problems exacerbate all mental and physical metabolic disorders. Vitamin deficiencies can result in mental and neurologic symptoms, especially thiamine, B1, folate, and B12. Any neurologist is going to check those the first thing when they see a dementia patient coming in. A lot of times we find they're really low. Why? Because they're required for energy at the mitochondrial level. Another thing that I like a lot is fasting, especially I like intermittent fasting. I do it. Fasting is so good for mental disorders. It promotes autophagy, which means cellular repair. It improves cognition, improves your mood. It increases BDNF, which is called brain-derived neurotrophic factor, which improves neuroplasticity. You can make new neurons. You can learn new things. Your brains, you don't lose those neurons permanently. You can regenerate neurons. That's a fairly new finding. Think about the ketogenic diet in epilepsy. It stops seizures in about 85% of people that medicines won't do it in. 85% of people get on a ketogenic diet and their seizures go away. But all the new drugs have taken over this simple thing. The gut microbiome is so important to mental health. It's that gut-brain connection. So important is your gut microbiome. Usually that's where I start in functional medicine, if you've ever seen me. This is such a good book that I hope really it'll refocus a lot of our mental health care providers to look at this functional approach to treating our ever-increasing mental health needs. I'm not against medicines. We use them every day, and sometimes we need them. But a lot of times what I find is they work for a while, then they quit working. Look at antidepressants. They just don't work that well. And then it can make it actually worse. And you can get a lot of side effects from it, like the guy who gained over 100 pounds taking those 17 different kind of psych medicines. I've seen that many, many times. So this is a complex and hard subject in today's medical world. I mean, that's why we need more functional medicine doctors out there. They'll spend the time to look through this stuff, not just a patient coming in, write your pill for you. Drug companies make money. Patient wants a pill. Everybody's happy, but it's not working. That's the thing. It's not working. We're getting more unhealthy all the time. It's simply not working. We need to simplify things. I think it's killing and bankrupting our country, personally. Look at all the mental illnesses around, the homeless, the obesity epidemic, and the epidemic of drug abuse. Mental illness is a huge part of this, and it ties so closely, it's so intertwined with metabolic disorders, which lead to all the heart disease and diabetes and strokes, high blood pressure, death. So think about functional medicine. I know a lot of you may not have the access to go to a functional medicine doctor. We just have to spend so much more time and energy researching all this stuff and really looking deeply into it. But it's really the only answer. New drugs popping up every day are not going to solve our basic problem. Your lifestyle is, and all these factors intermingle with each other. But it's just so interesting how mental illness is now being thought of as a metabolic disease, which I agree with. I've thought this for a long time, and now it's gained traction, it's gained legitimacy with this well-known Harvard psychiatrist writing this well-known book. I mean, there's a lot of people think this could change the face of the way mental illness is treated. It's an uphill battle because it's harder. You really have to get to the forefront of a lot of things, and life is not fair too. You're still dealing with social problems and trauma, but it certainly is a great place to start and look at things. And certainly you can get a cure. You can find the root cause and find a cure for this mental illness, not just sedating people and putting them on all these drugs all the time that are going to cause all these side effects. Not that they're not used. I use them, but I like to really approach it through a holistic, functional viewpoint. And I certainly think I've seen it work many, many times. I just hope more doctors, especially the mental health people, start thinking about this. So anyway, if you want to read a good book, There's a lot of wading through it, but think about mental illness as a problem with your metabolism. I hope this helps you, stir some thoughts. Any questions, please don't hesitate to call us or follow our broadcast, our podcast, and come in to talk to us. Thanks. I'll see you again next week.